Hello, everyone. Thank you for your interest in ParkSeek. Our project is focused on understanding the access and quality dimensions of parks and recreational facilities in Canada. So what is ParkSeek? ParkSeek is an historic cross-sectional collaboration in the making from researchers at the Human Environments Analysis Lab at Western University. And at the HEAL Lab, we've been working on healthy parks research for almost 2 decades now with projects like the STEAM project, Spatial Temporal Environment and Activity Monitoring Project, which looks at how children use their spaces and influences on their health. We've done a lot of park audits type projects to look at the quality of spaces and why parents prefer certain parks, as well as reports on opportunities for healthy living, and as well as systematic reviews on things like the accessibility and of nature and how exposure and access and use of nature influences children's mental health. And as well as other things about basically children's play. So who is leading this project? Myself, Dr. Jason Gilliland. I'm the PI on the project. I'm a professor in the Department of Geography and Environment, Health Sciences, Pediatrics, and Epidemiology and Biostatistics at Western University. And our project coordinator is Rebecca Clark and doctoral student Alexander A.J. Wray. And they are going to tell you a little bit more about ParkSeek. ParkSeek not only involves Western University, but we have scholars from a lot of other Canadian universities, including Wilfrid Laurier, University of Toronto, UNBC, UBC, Lakehead, Carleton, Concordia, University of Calgary, University of Waterloo, Dalhousie, Memorial, and Vancouver Island University. We also have private sector partners in Esri Canada, as well as Monteith Brown Planning Consultants who do a lot of work in the parks area. And we've already enlisted certain municipalities. So we have the City of London, City of North Vancouver, and North Vancouver District already on the team. In addition to the academics and the private sector partners and the municipalities, we have a lot of wonderful organizations such as Park People, Parks Canada, and as well as the Canadian Parks Collective for Innovation and Leadership. And we are growing every day.
All right, everyone. I want to thank Dr. Gilliland for that wonderful introduction to the project. And so now Rebecca and I are going to talk about how we kind of got it to where we are today. So really what happened was the Public Health Agency of Canada invited eligible organizations to submit letters of intent for their enhanced surveillance for chronic disease program. And what we did was we put together an application that really was all about addressing persistent public health surveillance evidence gaps. And what's meant by surveillance in this context is not like government surveillance, but more collecting data about the patterns of disease and its risk factors across Canada. And really the intent of this funding program is to support projects that develop a robust evidence base about those chronic diseases and conditions and their risk factors in Canada. And really the objective of this project was how do we apply new technologies, tools, and approaches to collect data for public health action? And really what this project excels at is this concept of big data, linking data together, creating platforms, creating apps, using GIS, and creating alternatives to traditional surveys. So the main focus of this grant program is to collect data about populations that have persistent gaps in chronic disease and risk factor surveillance. And also these key populations are key populations that we hear all the time in the parks community, that there's a lot of missing data about how they experience parks and protected areas. So we're really excited by this project to dive in and collect data from groups that traditionally have been underrepresented in this type of research. The second priority is on the built environment. And you might be thinking, well, wait, parks and protected areas are part of the built environment? Well, from the Public Health Agency of Canada's perspective, parks actually are a fundamental part of the built environment, and they're recognized as a key determinant of population health. And so given the limited evidence base, at least from sort of the Public Health Agency of Canada's perspective, we wanted to create a project that brought together the parks community and the population health community to work together to explore this idea of access to and use of parks and recreational facilities. And really, at the end of the day, what our project gets down to is looking at the quality and quantity of parks and recreational facilities in Canada and Canadians' access to those resources. And really, at the end of the day, what we're doing is going to be building distinctly Canadian data sets, tools, approaches, and knowledge about the links between parks and population health. So, what is ParkSeek going to accomplish? Well, we have 3 objectives. The first objective is to measure geographic accessibility to parks and recreational facilities across Canada. And I mean across Canada. We're talking federal, provincial, territorial, regional, local. We want to capture all the public parks and recreational facilities across the country and generate some geographic accessibility measures to these facilities. The second objective here is this quality piece, which we're going to do in a more limited fashion of only 12 communities, but still 12 communities right across Canada, ranging from very small villages all the way up to very large metropolis. And so these 12 communities, what we're going to be doing are on-site audits by trained field members, a household survey, which goes out to 100,000 Canadians, which it provides a great opportunity to collect information from folks who may not participate in parks and recreation currently. And then also we're deploying a smartphone app that will help us collect real-time information from folks as they're in a parks and recreational space. And the last objective here is this policy objective. And really what we're planning to do here is inventory, evaluate, and share plans, policies, and programs at all levels of government, and essentially create a platform that folks in the industry can share best practices, collaborate with each other, and then share those learnings publicly, and essentially create a knowledge sharing platform, which is what CPCIL was kind of founded to do. And so these 3 objectives come together to essentially address that research question of how do we address the quantity and quality of parks and recreational facilities in Canada. And now I'm going to turn it over to Rebecca to talk about what our approach looks like.
Thank you, AJ. Okay, so what is our approach? So through collaboration, we're going to be bringing researchers and practitioners together to collaborate on project activities. The project is also partner-driven, so this means that we're going to actively be engaging with partners to come up with activities that will result in mutual benefit for all. And then finally, we're going to be studying people and places that are underrepresented when it comes to parks and recreational facilities. So what are the outputs of the project? In terms of the accessibility part of the project, we will be creating a complete data set of parks and rec facilities for the entire country. We will also be creating geographic accessibility scores to various parks related resources. And this will allow for the creation of new spatial analysis methodologies for parks research and policy. In terms of the quality aspect of the project, we'll be assessing parks and recreational facility quality for 12 communities across Canada. So through household surveys distributed to the surrounding community, we'll be able to collect wide-ranging survey data from a national sample of Canadians. And then the final output in this section is a mobile app to gather immediate feedback from parks and rec users while they're in these spaces. So in terms of the policy aspect of the project, we will be creating a database of parks and recreational policies, plans, and strategies. We'll be assessing these through a health equity lens and covering all levels of government. And then this will allow us to foster a permanent digital best practices platform that can then be shared with the public. So when will ParkSeek happen? In terms of the accessibility part of the project, we're going to be gathering data from September 1st, 2020 to December 31st, 2021. We're then going to be calculating measures from January 1st, 2022 to December 31st, 2022. And then we're going to be sharing and refining data from January 1st, 2023 to March 31st, 2024. In terms of the quality aspect, we're going to be in the development stages from September 1st, 2020 to April 30th, 2022. Then we're going to be piloting our tools in London from May 1st, 2021 to December 31st, 2021. And then we'll be doing data collection in the 12 communities from May 1st, 2022 to December 31st, 2023. And then finally, sharing and refining our data from January 1st, 2023 to March 31st, 2024. In terms of the policy aspect, we will be compiling policies and documents from September 1st, 2020 to March 31st, 2022. We're going to be analyzing documents from April 1st, 2022 to March 31st, 2023. And then finally, we'll be sharing and refining our data from January 1st, 2023 to March 31st, 2024. And AJ will continue with the rest of the presentation.
Thanks so much, Rebecca. So really, what are we going to be doing today or at the conference if you're watching this ahead of it? Really, what we're going to be doing is breaking out into some discussion groups. And the discussion groups, as a reminder, are going to be based around the 3 objectives. So the first objective is accessibility, the second objective is quality, and the third objective is policy. And what's going to happen is over the next 40 minutes, we're going to have a 20-minute session where you can join any one of the 3 breakout groups for each objective. We're going to bring everyone back, and then we're going to go back into another 20-minute session where you can either stay in the same breakout group for the same objective, or let's say you're both interested in both accessibility or quality or policy or accessibility and policy, you can join a second breakout group for the second session. And this provides an opportunity for us to discuss really with your expertise, how you think parks and population health are linked. And that's really what we're looking for today. The other aspect and conversation piece that we'll be looking for is collaboration. So identifying opportunities for collaboration in the sector and involvement in projects. Who do you think we're missing? Who's not here at the table? And is there any interesting initiatives going on in your own community that you think would benefit the ParkSeek project? And finally, we'll be asking you to reflect on additional considerations that we should incorporate as we move through this development phase of the project. So we're really excited to hear from you. And we just wanted to leave you that if you would like to connect with us further ahead of the conference, you can email us at parkseek@uwo.ca. See you there.